Meanwhile, tens of thousands more Missourians will now have access to health care. It comes after voters approved Medicaid expansion in the state.
Medicaid expansion means adults who earn up to 133% of the federal poverty level will qualify for coverage. The earliest it could go into effect is next July. And before that happens, it's now up to the state to figure out how it's going to pay for expansion. I-Team reporter Jessica McMaster takes a look at those numbers.
Medicaid expansion is a done deal. Those in favor of it say the state will save money through additional reimbursements it receives from the federal government. Proponents argue taxpayers also pay federal taxes, and the cost owed by the state could be at least $200 million.
Currently, Missouri gets a 65% return on the cost of Medicaid. The reimbursement would increase for newly enrolled participants to 90%. Healthcare for Missouri, comprised of 250 groups in favor of the expansion, argue the additional federal reimbursement could bring in an extra $1 billion annually for Missouri.
It expands the eligibility, allowing basically over 200,000 more individuals, still low income, to get on the program, which will help with, everything from medicine to treatment, surgery, the health care that people need to live a healthy life.
Critics say not so fast.
There's no such thing as free money from the feds. We're a nation that's $26 trillion in debt.
Senior advisor for United for Missouri, Ryan Johnson, says making money off adding participants to a taxpayer-funded program isn't possible. The 90% federal reimbursement is only for new enrollees, which means Missourians will pay that additional 10%.
The auditor's fiscal note says that it will cost in excess of $2 billion.
A report from Health Management Association suggests other states have offset that 10% through matching program initiatives.
I question the veracity of that, and that's one of those things you're going to have to show me. Now, unfortunately, in my opinion, we're going to have the opportunity to see if that really bears out.
If Missouri does end up on the hook for that additional 10%, it's not clear where this estimated $200 million will come from in the budget. In addition, Johnson says if the federal government decides it will no longer provide reimbursements to states, Missouri would be on the hook for the total cost. I'm investigator Jessica McMaster, 41 Action News.
Thanks, Jessica. And one day after the primary, that issue of Medicaid expansion took center stage in the race for governor in Missouri. Democrat NICOLE GALLOWAY discussed it during a visit to Kansas City this morning.
We can expand health care without raising taxes or cutting other programs. As governor, that's exactly what I'll do. We're going to be bringing $2 billion into our state to invest in our economy and in our healthcare jobs, keeping rural hospitals open and providing access to healthcare for nearly 250,000 working people.
Galloway said she believes Governor Parson will try to undermine the will of the voters. Meanwhile, today, the governor said that the state will find the money to comply with the election results and make Medicaid expansion happen.
Yeah, well, the people of the state of Missouri voted that in, so we're going to have to deal with it and implement it. Big thing is, where do you find the funding for it right now? You're probably looking at $200 million or something like that off the bat, so we got to figure out where that funding is going to come from. So, hopefully, economy gets better. Hopefully, we can meet that financial obligation a little easier.